Have you been trying the latest workout craze, the latest fad diet, eating well, just nothing is working, you're not losing weight? Well, Dr. Andrew Petersen is back from Holtorf Medical, and he says there might be more to it than just that. How you doing? Welcome back.
Great, thank you.
Okay, so it's frustrating. You think you're doing all the right things, and nothing's happening.
That's right. You know, we talked about this back in January when everybody says, oh, I'm going to lose weight this year. It's now been, what, 5 months?
6 months, almost.
6 months.
It's almost June.
And what happens is a lot of people, they try, they put that effort in, and then they say it's not working and they give up.
Well, they burn out.
They burn out because they didn't make progress.
Yeah.
And the reason they didn't make progress is because it's not just what your doctors told you. It's not just you need to eat right and exercise. The reality is most people that are trying to lose weight are eating right and exercising. But there's more to it than that. And that's, you know, it's funny because in medicine, we worry about your high cholesterol, your blood pressure, your PSA. We do those tests to prevent things. Weight, 1/3 of Americans are obese, 2/3 of Americans are overweight. 2/3 of us are overweight. That's a disease that affects us with regard to our life expectancy dramatically. It affects us emotionally in a great deal. And yet, you go to the doctor and he says, you need to try harder. Imagine if he said that to you about your blood pressure. It's crazy. But there are metabolic things that affect this. Your endocrine system and your metabolism are dramatically affected by what you've eaten. But they don't return back to normal immediately when you change your diet to a healthy diet. And so you've eaten poorly for a little while. Sure, your weight is maybe a product of some choices in the past, but you change that choice and it doesn't just flip right back to losing weight.
I think it's also, you've got to remember that people set their goals too high.
I think that's a good
6 to 8
point.
weeks.
Yeah.
You know, make your goal, I'm going to lose 4 kilos in 6 weeks.
They're not specific about their goals. So if a patient comes into you and says, I've tried, I made that New Year's resolution, I actually did eat better, I did exercise, what do you ask next?
Well, I mean, I think the first thing is I believe them. They probably did do those things.
Right. Well, sometimes they think they did it.
My experience, they did it.
Right.
They did it, they just... And it's remarkable because for those of us that have not been overweight, we have this idea that, no, they didn't. But they are doing it. The difference is that they messed up when they became overweight. They messed up their thyroid, or they messed up their adrenal glands, or they messed up their leptin and their insulin. And if we don't check those things, how are we going to fix that problem? Leptin's huge. The research on leptin right now, it proves that that hormone released by your fat cells is trying to tell you to increase your metabolism and decrease your appetite. But it sort of doesn't work after a while. Anybody with a leptin over 12, they're not going to lose weight just by changing their diet and exercise.
So you're going
but nobody checks.
So they're going to take some tests so you can see if there's
absolutely.
what the underlying problem is, which makes people happy because they do. They're like, I swear I'm doing everything I can.
Well, it makes them happy because it validates them, but it makes them successful because your diet and your exercise matter a great deal. But without doing the things for their endocrine system that matter, it won't work.
So what are you doing different to help these people apart from the other diets that are out there?
Right. One thing is you can measure a person's basal metabolic rate. We have 2 tools in the office that we use to measure your basal metabolic rate. If you have been dieting, yo-yo dieting, there are studies that show that your T3 conversion, T4 to T3 conversion dropped by 50%. Well, we can measure and say, how many calories are you burning? And what happens is these people that have gained weight, now they're, you know, they were 120 and now they're 160. They have to reduce, based on their metabolic rate having dropped, they have to eat 500 less calories a day just to stay the same. If they don't, if they eat what they've been eating, they'll slowly put on 2 and 3 pounds. So we can check with what's called a med gym. We can check their weight. We can check their metabolic rate. We can check with a Thyroflex their metabolic rate. And then we can show them, oh, listen, let's fix the metabolic problem. It's not just a food problem.
It gives someone hope. And I have more questions. I know Troy does, and maybe you do out there.
I love this sort of topic.
I do too. You can get all your information from Holtorf Medical Group. They're located in Provo. The address on your screen, 524 West, 300 North. But we'll link you to their site from our website. So please do go to abc4.com/dailydish, and we'll put all that info on how you get a hold of Dr. Petersen. Thank you for being here.
Thank you, guys. Troy, it's great to meet you.
Likewise. I know you like Brie. It's all right.
Well,
it's
we
okay.
like you both.
But coming up next, I'm going to show you how you can make this fabulous cake and not feel so guilty about it with some of the ingredients.